Hey everyone. After doing some of this week's readings, I was really struck by this section discussing Ignaz Semmelweis and the epidemiology of childbed fever. Hopefully, this presentation will provide some more detailed information on puerperal fever, medical practice and ideology during the mid to late 1800s, and Ignaz Semmelweis and his contributions to the field of epidemiology. Semmelweis was a Hungarian-born physician that took his practice to a maternity clinic at the Vienna General Hospital in Austria, where he served as the director of the maternity ward throughout the 1840s. The maternity ward was divided into two separate clinics, the first run by midwives, and the second staffed with doctors and residents. During his tenure, Semmelweis noted that maternal deaths at the clinic staffed by physicians were much higher than those staffed by the midwives. This was quite troublesome, as the physicians had much more training, and it was thought that they should be able to provide greater insight into patient care. These mothers often became quite ill during or immediately following the birth of their child, with a condition known as puerperal fever. Puerperal fever, or childbed fever, is caused by Streptococcus pyogenes staphylococci, which is the same organism that causes scarlet fever. Puerperal fever was the result of an infection most commonly found in the uterus, pelvic lining, or stomach, causing high fevers, septicemia, and eventually death. Back in the 1840s, when all this was taking place, it was not common practice for physicians to wash their hands between patients or even between procedures. The thought was that doctors were gentlemen, and gentlemen's hands are clean. This ideology was coined by a Dr. Charles de Lucina Meigs, who, in addition to opposing what we now consider the fundamentals of personal hygiene, was also an advocate against obstetrical anesthesia. There was no way that doctors could be contributing to the demise of hundreds of women and their children, right? Wrong. Semmelweis became curious when a fellow colleague fell ill shortly after cutting his finger during an autopsy. The patient began to exhibit the same symptoms seen in the dying mothers. This sparked Semmelweis to investigate the possibility that deceased mothers were somehow passing along invisible organisms via the doctor's hands. He began to compare care and practices between clinics and the maternity wards, and found that medical students were going straight from their autopsy studies in the morning to delivering babies in the afternoon. To test his theory of invisible germs, Semmelweis had his medical students wash their hands in a solution of chlorinated lime after performing an autopsy and in between each patient. Keeping a detailed record of the results, he made some startling discoveries. The results were incredible. By simply washing their hands, Semmelweis was able to reduce the mortality rate in the obstetrical ward from 12.1% to 1.3% over a 6-year period. He was able to conclude that puerperal fever was in fact iatrogenic in nature, meaning the root of the problem lay in the hands of the physicians. Despite this nearly irrefutable evidence, the majority of the medical community dismissed his claims that hand washing could prevent the spread of disease. Although many of his students published essays and articles on their observations at the Viennese hospital, Semmelweis himself didn't publicly lecture about his findings until 1861, when he published his main body of work, Die Ethologie der Begriff und die Prophylaxis des Kindbettfiebers. Pardon my rusty German, but essentially translating to the etiology, concept, and prophylaxis of childbed fever. He was so bothered by the constant attacks and rejection of his ideas that he eventually suffered a nervous breakdown and was committed to a local insane asylum where he was reportedly beaten and later died. Semmelweis contributed to public health and epidemiology, the basis for germ theory and what we now consider one of the most common forms of disease prevention, hand washing, without which there would be undoubtedly countless more deaths. In this day and age, we all understand the importance of frequent hand washing as primary prevention of disease and sickness, and with the flu season fully upon us, I will leave you with a short video on proper hand washing techniques from the Center for Disease Control.
Try and avoid sneezing into your hand because you just contaminate them and then spread those germs everywhere. Focus on sneezing into your elbow, like this, and then you don't contaminate your hands. Turn on the water, wet your hands, apply a good amount of soap and lather up, and then focus on washing your hands for about 20 seconds, about the time it takes to sing Happy Birthday twice. Focus on washing the front of your hands, the back, in between the fingers, around the nails, and so on. And then rinse everything off. Use something to wipe your hands after that, preferably something disposable like a paper towel, and then use that to turn off the tap as well. If you get a chance, use that to also open the door to the bathroom as you're leaving. The best way to wash your hands is using running water and soap. But sometimes we don't have that available. So think about carrying with you a hand sanitizer. That should have at least 60% alcohol content.
For more information, visit www.cdc.gov or call 1-800-CDC-INFO.
Hopefully this presentation provided you a little bit more insight on Ignaz Semmelweis and the history of hand washing and their contributing factors to the field of epidemiology. Thanks for listening, everyone.